So our next speaker in today's presentation will be Amanda Slaunwhite. Amanda is a policy and research analyst at the Knowledge Exchange Center of the Mental Health Commission of Canada, and she is involved with numerous initiatives at the Mental Health Commission. Today she's going to be presenting some of her work in her talk entitled Exploring the Links Between Mental Health and Chronic Disease. Over to you, Amanda.
Welcome everyone, and thank you for having me. Today I'm going to be briefly outlining some preliminary results from a systematic review project that is being led within the Commission in partnership with the Public Health Agency of Canada, CDPAC, and the Conference Board of Canada. And I'm also going to be telling you more about the strong link between mental health and chronic disease and what this means for healthcare utilization, reform efforts, and prevention initiatives. Next slide. So first, I'd like to take a minute to engage you to ask where it is that you're calling in from. I think we have a vague idea of where everybody is.
So we've got people joining in from Newfoundland, on a check mark over on the Yukon, also Churchill, Manitoba, Wabush, Antigonish. You had Central, PEI, Saint-Albert, Truro, Nova Scotia. It's from Halifax.
It's wonderful to see people calling in from all over Canada. This is really fantastic to see. Unfortunately, moving to the next slide. So we thought it would be great to also know more about what it is that you do. So are you a researcher? Are you within a university? Are you a policymaker, or do you support a policymaker? Or are you a health services professional or a clinician? Or do you have another role that is health-related?
People are signing in, and lots of folks who are checking off in other roles, and they're writing community health, public health, a few policymakers, clinicians, mental health counselor, researcher, someone who is a survivor.
Fantastic. It's really great to see that we have participants that have different roles working in the health and non-health sectors. This is really fantastic, and your responses here trigger me to think that we should do these types of interactive things in our future webinars. So I guess moving back to the traditional kind of format, going back to the original topic, we do know that there's a strong link between mental health and chronic disease. Mental health and chronic disease are linked in terms of their high prevalence among groups of persons with some types of diseases or illnesses. So chronic disease and mental health problems and illnesses are also significant predictors of increased healthcare use and costs. We know that the relationship between chronic disease and mental health is complex, and it also works in two directions. So on the one hand, you have persons with mental health problems and illnesses who are at increased risk of chronic diseases like diabetes and heart disease. Whereas on the other hand, some persons with chronic diseases like cancer are at increased risk of experiencing mental health problems and illnesses. We also know that some chronic diseases and mental health problems and illnesses are more linked together than others. So, for example, diabetes has been shown to be significantly linked to mental health problems and illnesses such as schizophrenia, and they believe that this is in part due to high rates of metabolic syndrome, which could be attributed to antipsychotic drug use. So next slide. There is also a strong link between having a chronic disease and the development of mental health problems and illnesses. We know that rates of mental health problems and illnesses are much higher for persons with some chronic diseases, for instance, cancer, diabetes, and heart disease. For example, one study found that just over 28% of persons with diabetes in the study were estimated to experience depression in their lifetime, which is, of course, much higher than the rate of depression for the general population, which in Canada is estimated between 8 and 10%. Likewise, another research study found that about 30% of persons with heart disease had mild to moderate symptoms of depression, and this is again much higher than the general population. Next slide. So vice versa, research also tells us that persons with mental health problems and illnesses are more likely to develop some chronic diseases than those who do not have a mental health problem or illness. Research has found that the prevalence of diabetes is 2 to 3 times higher for persons with mental health problems and illnesses than the general population. In terms of cardiovascular disease, there are similar trends, with some research suggesting that persons with depression are at greater risk of cardiovascular disease than those who do not have depression. Despite these trends, however, of higher prevalence and risk, we know that there are low rates of preventative screening and significant gaps in treatment for chronic diseases among persons who have mental health problems and illnesses, which may be in part due to stigma. Next slide. These trends have significant implications for productivity, quality of life, work absences, and healthcare. Comorbid disorders can negatively impact productivity through work absences and poor health, which of course can impact performance and quality of life of the workers. They can also increase healthcare utilization and costs. However, secondary prevention and early screening and treatment of these disorders has been shown to potentially reduce healthcare utilization and costs and improve health outcomes. So, for example, a Canadian intervention aimed at improving the psychological well-being of women with breast cancer found that their program resulted in a healthcare expenditure reduction of just over 23%. And when we think of that type of potential reduction across the healthcare system for multiple types of chronic diseases, the positive impact could be very significant. So to improve our understanding of chronic disease and mental health and their relationship to one another, the Mental Health Commission of Canada is leading a systematic review project in partnership with CDPAC, the Public Health Agency, and the Conference Board of Canada. This project is still ongoing, and today is just a snapshot of some very early results. Throughout the research process, representatives from CDPAC, PHAC, and the Conference Board advised us on the methodology that we use, themes, topics of interest, and the analysis of results. Next slide. So our research approach was to determine why persons with mental health problems and illnesses and selected chronic diseases were at increased risk of comorbidity by summarizing how the behavioral and psychosocial pathways to mental health and mental illness relate to diabetes, CVD, and cancer. We really focused in this project on behavioral and psychosocial factors, but only included studies that had some measure of biological and physiological change because of the importance of these variables and factors to disease formation. Next slide. So we used a systematic search and review strategy to select and summarize results. Without going into this in depth, we really focused our review on high-quality research. So this mainly included prospective cohort research studies, if you're a research guru, with sufficient sample sizes and rigor. By summarizing the most robust research out there allows us to understand causal relationships between risk and protective factors and their importance to disease formation. So next slide. There you go. So what did we find when we went to the literature? One more. So in terms of the common pathways from mental health problems and illness to cancer, diabetes, and CVD, we found that the research indicated that there were several risk factors that were common among disease groups. So for example, smoking is a risk factor for diabetes and some cancers for persons with depression and schizophrenia. Likewise, alcohol use was also a risk factor for diabetes and cancers for persons with schizophrenia or depression. We also found that low education was a risk factor for persons with depression developing diabetes and persons with schizophrenia or bipolar disorder developing CVD. Next slide. So we're moving in the opposite direction from chronic disease to mental health. So in terms of this directionality, we found that the lack of social support and lack of optimism were both risk factors for the development of psychological distress, anxiety, or depression for persons with selected types of cancers and cardiovascular conditions. We also found that the severity of the chronic disease was also a risk factor for the development of psychological distress and depression for persons with diabetes and cardiovascular disease. So one more. So in terms of the pathways, our initial scan and analysis suggested that the risk factors for the development of mental health problems and illnesses really emphasize psychosocial factors over behavioral factors that impact disease formation. So this includes, of course, having social supports, such as friends and family members that can support you when you're diagnosed and then through treatment and beyond. However, we found a different trend when it came to the risk of chronic diseases for persons with mental health problems and illnesses. I think this is really important. For persons with mental health problems and illnesses, the risk factors for chronic disease development were more significantly behavioral or physiological or biological oriented, as opposed to psychosocial in nature. And we think that this is a definitive result that shows some differences in terms of the directionality of these risk factors. The next slide. So how can these results be transferred into practice? Well, many of the pathways identified in our project have complementary prevention initiatives or programs that work to enhance protective factors that will reduce risk. And John Higginbottom is going to talk about this further. So these prevention initiatives could work to modify behaviors such as smoking or risky drinking. We can also reduce risk in community or institutional settings by enhancing psychological supports and introducing secondary prevention initiatives that continuously screen and promote the early detection of symptoms to reduce the disease severity. So the next one. So based on the work highlighted in the webinar today, and more generally, we know that prevention is important and critical to reducing comorbid chronic disease and mental health-related disorders. Next slide. To do so, however, we need to learn more about the pathways or the reasons why persons with mental health problems and illnesses and chronic diseases develop comorbid diseases in order to reduce risk. So we need to know more about this phenomenon in order to design or better understand interventions or initiatives that may work. So in this project, we have identified numerous gaps, challenges, and opportunities. For example, we found that there was limited work completed in Canada and that high-quality evidence, like projects that use cohort research designs, were severely lacking. They're just not out there. We identified a number of priority areas, including research that uses samples of persons with mental health problems and illnesses, younger populations, and at-risk groups. Next slide. So at the Commission, we've endeavored to identify best practices for the prevention of mental health problems and illnesses and related comorbid conditions through various projects and initiatives that span the life course and in different types of settings like work, the home, or schools. And these, of course, include Turning the Key, which outlines promising practices for stable housing for persons with mental health problems and illnesses, creating a psychologically healthy and safe workplace, and the guidelines for comprehensive mental health services for older adults. So next slide. Just to wrap this all up, our research has shown that there's a complex interaction of behavioral, psychosocial, biological, and physiological factors that increase the risk of comorbid mental health problems and illnesses and related chronic diseases. We believe it's important to remember, however, that this isn't a problem without a solution. So we can reduce risk. We can do something about these rates, primarily through primary and secondary prevention initiatives. Our research has also shown that there's a real need for a collaborative approach to this issue, whether that's increased collaboration in clinical settings, for example, through family health teams, collaborations between institutional and community care, or collaboration between provincial and national organizations to mobilize around this issue. So I invite you to please stay tuned. We're going to be releasing a final report with these results in the next couple of months. And I also encourage you to learn more through our website about some recently introduced initiatives related to chronic disease and mental health that are being led at the Commission, which includes the CHEER initiative. And you can learn more about those on the Knowledge Exchange Center website for the Commission. So last slide. Thank you.